medical terminology. Okay. So in medical terminology, there are three things, common three things. One is word root. Okay. Another thing is suffix, and another thing is prefix. Prefix means before. Okay. So let me show you in one more thing. So we were discussing three things: prefix, word root, and suffix. Okay. So all medical terms are the combination of either prefix or word root or suffix. Any combination of two or all of three. Okay. Prefix normally it uses in starting of the words. So if you done the graduation in chemistry, so you have learned the suffix oic acid, al, है ना, yeah, ethanol, methanol, propanol, है ना. So you use suffix al, oic. So these. So same suffix and prefix we will use here in medical terminology. So have you heard these terms? Television, telephone. Yeah. So what's common in both?
Tele is the common. Television is the TV like.
TB. TB is the short form of the television. Okay. So television means far side. So if anything is the away from you, still you can watch.
Yeah.
Or telephone, you can listen. So tele means away. So whenever we use the suffix tele, it indicate the away thing. Okay.
Suffix.
No, it's a prefix.
Suffix.
Prefix is always in the starting of the word, and suffix is after, in the end of the word. Okay. Now, hypertension. So hyper is a suffix or prefix. Hyper is a prefix which indicate high. So hypertension. Tension means blood pressure. Okay. So hyper is high. Tension is blood pressure. So hypertension means high blood pressure. So whenever there is a prefix hyper, the meaning will automatically tell that it's a high. Okay. Hyperkalemia. Now you know the meaning of hyper. It's a high. But you are not aware about the kalemia. So kalemia is potassium. Potassium. So hyperkalemia is high potassium. Okay. So whenever is it's mentioned hyperkalemia, you will understand that the patient have higher potassium. Okay. Similarly, hypercholesterolemia. Again, you are aware about the cholesterol. Okay. And you are also aware about the hyper. So if somebody have high cholesterol, then the medical term will be hypercholesterolemia. Okay. Same hypernatremia. So natremia means sodium. Okay. So high sodium, hyperthyroidism, high thyroid. Okay. So this is the only one prefix and we get multiple words. And we are the main reason to start medical coding training with medical terminology. Until unless you recognize and learn the medical terms and understand that what is the meaning of that particular term, you are not able to understand. Okay. So that's why we always start with the small things. Okay. So hyper is only one prefix.
Prefix.
So there may be hundred or thousand of prefix are there. So the more you learn, the more you will able to understand the things. Okay. Now, hypo is low.
So,
Yeah. So hypertension is
High.
high blood pressure. And if somebody have hypotension, then low blood pressure. ठीक है? Hypokalemia, low potassium. Hypocholesteremia, low cholesterol. Hyponatremia, low sodium. Hypothyroid, low thyroid. So everything will be low. In hypo, it's a low, and hyper, it's a high. Okay. There are some more prefix. A means without. A means without. N means is also without. Okay. So aesthesia is a term which tells sensation. Okay. So have you heard the word anesthesia? No, no, no. We will not. Okay. So what we will going to learn, we will going to learn point to point things. Okay. Because if I am an interviewer, I always want that what is the meaning of that particular things. है ना? If you say that you okay, so you are trying to say that in hospital, whenever a physician done the surgery, they give the anesthesia. है ना? So you are telling the procedure, but I am just want to listen that what is the meaning of anesthesia.
okay.
Okay. So aesthesia, what is the meaning of aesthesia? Check your screen.
Sensation.
Sensation. And what is the meaning of N?
Without.
Without. So what is the meaning of anesthesia?
Without sensation.
Without the sensation. So once the physician give the anesthesia, the sensation is zero. है ना? So there is no sensation. So if the physician perform the surgery, the patient did not feel any pain because there is no sensation. Okay. So that's how we need to learn the things. Okay. So this is the one part, anesthesia. There are n number of prefix which we will learn later. Okay. Then the word root, the main term. Okay. The main term. So who is cardiologist? If somebody have heart problem,
Yeah.
he went to cardiologist. So cardio is heart.
Heart.
Technically, cardi is heart. Okay. Cardi is heart. But what we are going to put O every time. Whenever there is a word root, we will put O.
Old.
We always put O. Okay. So just give me one moment. So just check cardio, gastro, nephro. So whenever there is cardio, that is always represent heart. Okay. Now it's not complete a word. So now either we need to use prefix or the suffix. So now we will use suffix. So what is the like you have physics, chemistry, and biology. ZBC, na? Zoology, botany, chemistry,
No. Analytic.
analytical chemistry. Okay. So have you heard the biology?
Biology.
Biology?
Biology.
No? Okay. So biology have two branch, botany and zoology.
Botany.
है ना? So what is the meaning of biology? So which subject you have in graduation?
Analytical chemistry.
Okay, in 12th, which subject you have?
It's chemistry. Sir.
Math, physics, chemistry, PCM. Okay.
In our state, we used to call NPC.
Okay. So here we tell, so okay. So biology, sociology, है ना? So in 10th you learn na biology. So what is the meaning of biology?
The natural science.
No. Bio means life. Bio means life. Or logy means study. So meaning of biology is study of life. Okay. So we learn, but we did not go in deep. Okay. Sociology, है ना? Social science, study of social studies, है ना?
History.
हाँ, no, history is different. Okay. So if I say cardiology,
Cardiology.
so what is the meaning of cardiology?
Heart.
Heart is cardio.
Okay.
Then what is the meaning of the cardiology? No.
Biology.
No. It's simple. Logy means study.
Biology study.
And cardio means
Heart study.
heart study.
Yes.
Keep it very simple. So if somebody is asking that, what is the meaning of cardiology? Study of heart.
Study of heart.
है ना? Now, logist is a specialist. Logist is a specialist. Logist is a suffix. And logist, the meaning of the logist is specialist. Okay? Logist. 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 Logist means specialist.
Specialist.
Specialist. Specialist who knows everything. है ना? So what is the meaning of cardiologist?
The study of heart.
No, that is cardiology.
Cardiologist.
What is the meaning of cardiologist?
Cardiologist. Specialist. Heart specialist.
Heart specialist. Yes. Specialist of heart or heart specialist. Okay. So now you learn two words related to heart.
Yeah.
Okay. So megaly is enlargement. Megaly is megaly. Megaly is enlargement. MEGALY. Megaly is a suffix which indicate enlargement. So what is the meaning of cardiomegaly?
Cardiomegaly.
Megaly, cardiomegaly. No.
Megaly.
Megaly is enlargement. So cardiomegaly is enlargement of the heart. Cardiology is the only study of heart. Cardiologist, heart specialist. Cardiomegaly, enlargement of the heart.
This one little I didn't understand because
So what is your full name?
my full name.
Huh?
Paili Vinay Kumar.
Paili Vinay Kumar.
Yes.
Okay. So I say Vinay Kumar. Okay. My name is Vikas Maheshwari. Okay. So let's me interchange both surname. So my name is Vikas Kumar and your name is Vinay Maheshwari. है ना?
Yes.
So Maheshwari is a surname.
Surname.
है ना? Same way, like logist is a suffix. It's a depend on with which medical word we will use it. Okay. So, okay, just see the screen. Gastro means?
Gastro means.
It's a stomach. है ना? So gastrologist?
Specialist.
Specialist of stomach.
Specialist.
Or entero means is intestine. Okay, so you heard gastroenterologist. So specialist of stomach and intestine. Entero. Enter na? ये this one. है ना? Entero means intestine. So gastroenterologist is the specialist of stomach and intestine. No, not kidney. Kidney is nephro. Okay. Got it?
Yeah, sir. I didn't see this entero.
Intestine. Entero is intestine.
Intestine.
Okay.
Yes.
So itis again is a suffix. Itis is a suffix. ITIS. ITIS. Itis is a suffix which indicate inflammation. है ना? So what is the meaning of gastritis? Check what is the meaning of gastro.
Stomach basic.
Or itis means
This
inflammation. Itis means inflammation.
stomach inflammation.
Stomach inflammation. Okay. Logist means specialist.
Specialist, logist,
हाँ
specialist, ist.
नहीं
That is also
स्पेशलिस्ट या जैसे पीडियाट्रिस्ट ऑर्थोपीडिस्ट है ना. नाउ नेफ्रोलॉजिस्ट किडनी स्पेशलिस्ट एंड नेफ्राइटिस नेफ्राइटिस
nephritis.
हाँ
वो भी kidney specialist है ना sir.
ओ आइटिस
Kidney, it is kidney inflammation.
kidney inflammation. So itis is kidney inflammation. Okay. Hepato. Hepato. What is hepato?
Liver.
No, liver. Only hepato is liver. Hepatitis?
Liver specialist.
No, no.
Liver inflammation.
Inflammation. Liver inflammation.
Yes.
Itis is inflammation. Hepatomegaly?
Liver specialist.
What is the megaly?
Management.
So hepatomegaly is hepatomegaly, liver enlargement. Okay. So in this way, you need to learn medical terms. Okay. So nephrectomy. Ectomy means removal. Ectomy is removal. And nephro means kidney.
For kidney.
Yeah.
Yeah.
So nephrectomy is nephrectomy. Removal of kidney. So you need to learn more and more prefix, word root and suffix. Then you can make a combination of all these. है ना? Then only you will learn what is the meaning of that particular word. Because until unless you are not able to read the medical record, you will not understand the purpose of that particular medical record, and you are not able to identify the diagnosis and the procedure. Okay. So medical terms, to learn the medical terms are very important. And in examination, there will be 8 questions in your CPC certification exam. 4 from the medical terminology and 4 from the anatomy. Okay.
But the day you said we'll do
CCS.
CCS.
I told you that there are 2 certification, CPC and CCS. So initially the training will be for CPC certification, and after checking your performance, है ना, we will go with the CCS. Because CCS is little bit harder. Okay. Okay. So if you are not cope up with these easy certification, then CCS will be tough. Okay. So initially the training will be same. Once your CPC certification training is over, then we will check your performance, and according to your performance, we will decide that whether you will go for the CPC certification or the CCS certification. Because our goal is you need to be certified and you need to get the job. Okay.
After 2 months, no? Exam will be.
Yeah, we will try that you complete your training in 1 month, and next 15 days you can give the exam. Okay. Okay. So there are 3 rules. Okay. So what we learned till now: prefix, suffix, and word root. Word. Okay. Now, when we connect word root with suffix, okay, when we connect word root with suffix, and if suffix start with consonant. Yeah. So what is consonant? There are 26 letters in English alphabet. And there are two things, vowels and consonant.
Consonant.
है ना? So how many vowels are there? 5.
5 vowels.
Yeah.
Double.
A, E, I, O, U. So there are 5 vowels. A, E, I, O, U. So if anything pronounced with these, start with these letters, okay, then they will consider as vowel. Okay. But here, what I am saying, when we connect word root with suffix, and if suffix start with consonant, so these 5 letters should not be there. It's a logist. Logist start with L. So L is consonant. M is consonant. N is consonant. But A is vowel. Okay. So whenever we start word root with consonant, in that case, we will use connector O always. Okay. So I told you that Cardi means heart, but we will always use O with word root.
Yeah.
Okay. So now we are connecting word root with suffix. So Cardi is heart and logist means specialist. So L is consonant. So we will use connector O here. So the medical term will be cardiologist.
Yeah.
Okay. Cardiomegaly. And again, it's the M, start with M, which is consonant.
Sir, it is consonant.
Then we need to connect with O. Cardiomegaly. Okay. Now, rule 2. When we connect word root with suffix and suffix start with a vowel, that is A, E, I, O, U, in that case, we never use connector O. है ना? Gastritis. So we will not use O here because our suffix start with I. I is a vowel.
Yes, sir.
So the term will be gastritis, not gastroitis.
Yes, sir.
Okay. And dentist, not dentoist. Okay.
Yes.
Gastrectomy, not gastroectomy. So we will not use O in that case. Okay. So any difficulty you found till now?
Difficult.
Are you able to understand what you are learning?
Yes, sir. But the thing is, rule 2, we used to. Yes, sir. We are using it is na sir, like dentist. But in these vowels, A is also there, na sir.
Where?
E, I, O, U.
Where? Huh.
Yeah.
A. So which you have confusion in which one?
It is.
Itis, na?
It is.
So that's why we will not use na O.
Yeah, but I is also there, na sir. Vowels.
Where?
In vowels, there are 5 vowels, na sir. Like A, E, I, O, U. In that, in these 5, I is also there, na sir.
So what written over here? Read.
Yes, sir. Here I is also there, na.
Read complete
In
sentence.
this case, we never, when we connect word root with a suffix, and if the suffix start with the vowel, okay, start with those words. Okay, okay, sir.
In that case, we never use connector O.
Oh,
So that's why O is not there, na?
yes, sir. Yes, sir. The starting words are G, D, G.
No, not this one. This one. Suffix is this. Suffix is always come last.
Okay, L, M.
So it's start with L, then O is there. Cardiologist. It's start with M, O is there.
Yes, sir.
But when it start with I, E, O, U, then there is no O. You cannot use O.
Okay, sir.
Okay. It's not come in your examination, but to learn that.
Yeah, yeah.
Because sometimes you say why O is there, why O is not there. So that is the rule which state that if suffix is start with vowel, there is no need to use connector O.
Oh.
है ना? Right now we are learning how the medical terms form. Okay. Rule 3. When we connect one word root with another word root, in that case, we will always use connector O. Okay. Whether it's vowel or consonant. So if you are connecting two word root, always use connector O. Okay. So देखो. Now see here, gastroenteritis. So gastro is word root, entero is word root, but itis is suffix. So we will use word root here, but not here, because it's suffix.
I think it's one.
Which one? No, no, not it's a, gastro is word root, entero is word root, itis is suffix. So when we connect two word root, we always use connector O. Okay, so that's why the term is gastroenteritis.
Gastroenteritis.
Yeah. So O is there. Now, hysterosalpingo-oophorectomy. This is word root, this is word root, and this is word root. Hystero is word root, uterus. Salpingo is word root, fallopian tube. Oophoро is word root, ovary. And ectomy is removal, which is suffix. Okay. So we will not use word root connector O here, but we will use O here, O here. So you can see that three O are together.
Yes.
So word will come with the hysterosalpingo-oophorectomy. Salpingo-oophorectomy. So triple O are there.
Yes.
And it's easy. If you break down a medical term, you are able to pronounce it. Because pronunciation is also very important. Yeah. So ectomy is removal. So removal of hysterouterus, salpingo fallopian tubes, not tubes, fallopian tube, and ovary. Okay.
Fallopian tubes and ovary.
These are the female genital system.
Yes.
Okay. Then hepatosplenomegaly. So M is consonant. So we will use connector O here.
Yes.
So word become the hepatosplenomegaly. Yeah. So these are the three basic things like prefix, suffix, and word root.
So before that, you have said that in rule number 3, female genitals. Is that required to know that
every organ you need to understand? So
belongs to female or male also?
we will go through all the body parts. Okay, whether it's a male, female, whether it's a heart, bone, you will learn each and everything. But okay, I will give you the example. Okay, so in your family, there is a boy or girl who is 3 years old. Can she go through the newspaper? Can she or he read the newspaper?
No, sir.
No, why?
Because their brain growth is different, sir.
No, not brain growth. Why they cannot learn? Because to read the newspaper, first they need to learn the ABCD. ABCD. Okay. Then they need to learn the word formation. Then they need to learn the sentences. Then the paragraph. Then they can only read the newspaper. Now, you are same like 3 year baby or boy.
Yeah.
Okay. So to understand the medical terminology, you need to first learn the ABCD of the anatomy. So right now we are learning the ABCD. Then we will learn the word formation. Then we learn the sentences. Once you've done the sentences, then your coding training will start. Okay. Okay. Until unless you learn the sentences, you will not understand how the medical record need to be read. Okay. So we are learning ABCD. है ना? And the ABCD is the difficult thing. Okay. Once you learn the ABCD, then things will be easier. Okay. So now there are common word root. Okay. What is cardio?
Cardio. Heart.
Heart. Okay. What is bio? Life. Only life. Bio means life. Cerebro. So you have not learned this. Cerebro is brain.
Brain.
Cephalo is head.
Head.
Okay. Arthro means joint.
Joints.
Yeah. So have you heard this disease arthritis? It's a joint inflammation. It's a painful condition. Na? So oma is a, so whenever there is I mention hyphen before any term, that is suffix. Okay. So oma is tumor.
Tumor.
Yeah.
Like brain tumor.
Brain tumor, है ना?
Coma, that's
Huh?
that is that
Oma.
not common.
No. Meningioma. Hematoma.
Hematoma.
है ना?
Yeah.
Hematoma is, hemat means blood.
Blood.
And oma means tumor.
Yeah.
So whenever there is a blood collection in your body, then that called hematoma. Al means pertaining. You say abdominal.
Abdomen.
है ना? Stomach, your abdominal cavity, है ना? Abdominal. Itis
Is
inflammation. Logy,
logy specialist.
no. Logy is study.
Study.
Yeah.
Study.
Logy is study. So there is a specialist which we call dermatologist.
Skincare.
Skin. So dermato or dermo means skin. Because logist is a specialist.
Yes.
है ना? तो skin specialist is dermatologist.
Yeah.
Scopy. Have you heard any scopy? Arthroscopy, colonoscopy. है ना? Scopy is visualization. Yeah. So if a physician done the arthroscopy, he put this arthroscope in your joint, then visualize. Colonoscopy, he put the colonoscope in the colon area, then visualize. EGD, in through the mouth they do the scopy. So whenever there is a word scopy means visualization. Ik is again pertanic, it's a cardiac. Yeah. Gram, record, electrocardiogram. ECG बोलते ना? That is ECG, electrocardiogram. Okay. Opsy, I don't know. Erythro means? Erythro. There are color. Okay. So you need to remember some colors. Erythro means red. Erythro means red. Red.
Red color.
Red color. Okay. So you have white blood cells and red blood cells. So red blood cells are erythrocytes. And white blood cells, leukocytes. So leuko means black. Sorry, no, leuko means white. Leuko means white and erythro means red. And xantho is again a color. Xantho means yellow. Not blood cells. Xanthoma, there are couple of disease which will come. So in your examination, Sometimes they mention like word root which indicate the color and melano. So if somebody have the melanin, high melanin, then his color is black. So melana is black. Okay. Gastro means stomach. Entero, intestine. Intestine. Then hemato is blood. है ना? Nephro means kidney. Leuco, अभी just 1 minute ago we discussed colors.
Yeah, black.
No.
White blood cells.
Leuco, not blood cells, because leuco is
white.
white. Leuco is white. है ना? Hepato, hemato is blood. Hepato is liver. Hepatomegaly, hepatitis.
Okay.
Hepatitis is very common disease. No, not common, but most of the times you see that hepatitis A, B, hepatitis C, है ना? Neurologist. Neurologist. Who are neurologist? Specialist in nerves. So neuro means nerves. Gyneco, female. Gyne means female. Okay. So these are the prefix, suffix, and word root. We will give you more prefix, suffix, word root list so you can remember things. Okay. Then we have body cavities. Cavities. Okay. So have you heard the dental cavity? What happened in dental cavity? If your teeth became hollow, है ना? Then we say that cavities is there. So cavity means hollow area. Okay. So there are 5 cavities in our body where our organs are safe. So one is cranial cavity, where our brain are keep safe. Okay. Thoracic cavity, where our heart and lungs are safe. Abdominal cavity, liver, gallbladder, pancreas, intestine, all these are organ in gallbladder. Sorry, abdominal cavity. And then we have pelvic cavity. Genital organs are safe in pelvic cavity. Then we have spinal cavity. Our bone marrow are in the spinal cavity. Okay. Any query till now you have?
Oh, sir. I'll study the more.
Studies, practice is the part to become a successful medical coder. The more you practice, the more you will learn. Okay. Okay. Then there are quadrant. 4 quadrant we have. So one question sometime came in your examination. They will give you the organ and they will ask that in which quadrant that particular organ is fall. Okay, this is also in your CPT book. So once we will start the CPT or ICD, we will show you. है ना? So if you forget, then the anatomy is also in your book. Okay. So right upper quadrant. So this is like the division of your abdominal area. है ना? So it's divided in 4 quadrant. Right upper quadrant, right lower quadrant. So this is the anterior view. So the right in the image is always on your left side. Yeah. So if you say that it's a mentioned right upper quadrant, but it's on your left hand side. And it's the left upper quadrant, it's on your right hand side. Okay. So if we divide it in our body, then the liver and the gallbladder in right upper quadrant. So there are organs, है ना? Liver and gallbladder in the right upper quadrant, है ना?
Yes, sir.
Then left upper quadrant, liver left lobe, है ना? Stomach, spleen, part of pancreas. So any organ they will give you, है ना? And they will ask you that in which quadrant that particular organ fall. Now, positional and directional terms. So if physician perform any surgery, है ना? So he will mention these terms. So anterior is anterior or ventral. Either say they say the anterior or they say the ventral. It's always front. Okay, front side of the body. And posterior is or dorsal is the back side of your body. Okay. So anterior is chest and abdomen, and posterior your back.
Backbone.
Not bone, it's a back side of your body.
Backside of the body.
Then deep. So whenever is our exam, there are two type of study: superficial study and deep study. So what is superficial and what is deep?
Deep means like more.
More study, more in detail.
Yes, sir.
So in terms of your body, superficial is just upper layer.
Yeah.
Upper layer. Oh, okay, somebody said that injury is not that deep. There is a deep wound. Deep wound means the depth is more, the more inside. है ना? Superficial, just above the layer, upper layer of the skin. है ना? So deep, so you are now understand, a physician say that there is a deep wound. So you will understand that the wound is a little bit complicated. And he says that there is a superficial injury. So that is not much worry about that particular injury. Okay. Now we know learn not need to learn that now we need to learn that proximal and distal.
Proximal
And distal. Okay, so we have these joints. Okay, just here, see here, joint. Okay, one joint here, one joint here, one joint here.
Yes.
So the proximal is near to the attachment.
Okay.
Okay, so this is joint, then this area is proximal.
Proximal.
Okay, this is my joint, this area is proximal.
Here,
Middle is soft.
soft.
Middle is soft. And away part is distal.
Okay.
So for this bone is humerus.
Okay.
And this joint is shoulder.
Shoulder.
And this joint is elbow.
Elbow. Yeah.
So the humerus part towards your shoulder is proximal.
Proximal.
And away from the humerus is distal. Away from the shoulder is distal. So this is the one bone. Okay. The middle part is shaft.
Shaft.
The proximal part towards the shoulder is proximal.
Proximal.
And the away is distal. Again, there is another joint.
Yeah.
This is the bone. One side is radius and one side is ulna.
Okay.
Okay, the thumb side bone is radius. Thumb side bone is radius. So the radius part towards your thumb is distal radius. है ना? नहीं, distal radius. And toward your elbow is proximal elbow. Proximal radial. And mid is shaft. So anything which is near to the attachment towards your body is proximal and away from the body is distal. So you can say that the radius part is also near to the joint. So it can be proximal. No, it is always distal. This bone is proximal to the elbow. Okay, because we are going towards the body. Yeah. Okay. So now you understand the proximal part and the distal part. Far from the point of attachment to the trunk or far from the beginning of a structure. Example, at a distal end, the femur joint with the knee. Okay. Then we have inferior and superior. This is, we have like in if you're working in an office, in office, there are senior and junior. Yes. So seniors are the above you and juniors are the below you. Okay, and who are working with you, they are colleagues. You know? So the same thing we have. So anything we have Below another structure is inferior, and above another structure is superior.
Inferior and superior.
Inferior and then we have medial and lateral. Lateral means side.
Side.
Side. Side.
Side. Side.
So we have two lateral sides, right lateral and left lateral. There are only two sides, and medial is middle one.
Middle.
Now it's also come in certification exam, supine and prone.
Fine.
And prone. So there are shooting in Olympic. So supine is if there are shooting all in the Olympic there is a shooting championship, है ना? So there are three position: standing,
Sitting.
sitting, and
Running.
prone.
Swimming.
Not swimming. After lying on his belly, he need to shoot, है ना? So that is supine. If patient is lying on his prone, that is prone. If patient is lying on his belly, on his abdomen, that position is called prone position. If patient is lying on his back, that is supine. Because if physician need to perform any sort of surgery, the patient need to be on the table, either in the supine position or in the prone position. So if you need to done the surgery on the anterior part, then the patient should be lying in supine position. And if he want to done the surgery on the back side, then patient lying onto the prone position on his belly. Okay, so that is the these also required, because sometimes physician did not mention the approach, but you have a CPT code for anterior and posterior. So you need to check that whether patient is lying on the supine position or in the prone position. If he is in the supine position, then the approach is always anterior approach. And if he is lying in the prone position, then the approach is always the posterior approach. Okay. Then there are three planes, body planes. Okay. So you have see the movie, 2D movie, 3D movie.
Yes.
है ना? So 3D is three dimensional.
3D.
Okay. So there are if the body of a patient cut into they can cut in three axes. Okay. One is frontal. Frontal is coronal. Frontal means no. The body divided into anterior and posterior part like this. They can cut the body like this, anterior and posterior. ठीक है? Sagittal is left and right. They cut the body in the left and right.
Okay.
And the transverse is upper and lower. There are no fourth way they can get the information. Either they cut the anterior and posterior, left and right, upper and lower. So these are the three plane. If you identify that, then okay. So the one
side surgeries also.
no, this is the like maybe used for MRI and CT. Okay. And sometime in like postmortem and all these things. Okay. So now what I am going to do, I am going to give you a break. Let me first stop this.